Today I'll try to explain few things regarding recurrent implantation failure. Now, when we call a thing a recurrent implantation failure, when more than 3 good quality embryos transfers or 10 embryos in multiple cycles we are transferring to the patient without achieving a clinical pregnancy, then that situation we may call as recurrent implantation failure. And there are different causes maybe behind it. The first line of investigation should be regarding the lifestyle factors like body mass index. If the body mass index of the mother is very high, then it may happen. Smoking more than continuously 5 years, that may also found reported as a reason of it. And there are other reasons like immunological reasons, endometrial receptivity, microbiome of the uterus, the mother, anatomical abnormalities. Male factors are not mainly responsible for, but to some extent it has also been found to be responsible for the aneuploidies in the embryo. And the embryo aneuploidy obviously one of the major cause of recurrent implantation failure. In the immunology factor, there are different factors, though the main thing that is being considered are that KIR, that is that's a protein which is being expressed in the natural killer cells. There are different genotypes of that protein which are responsible to bind with the HLA types on the extravilus trophoblast cell of the embryo. So whether it will bind or not, that depends on the specific genotype. But the main thing is when to test for what. The cause of recurrent implantation failure is very different from person to person. So one kind of investigation is not proper for all the patients who are facing recurrent implantation failure. It should be specific to individuals where we need to see the endometrial receptivity. It is not like that in each and every case we need to do the ERA. It's not that. Where the endometritis is responsible, then we need to investigate regarding the microbiome of the endometrium. Whether in the endometrium, the good microbiome, that is the lactobacillus, it's enriched with that. Whether we are having uriplasma, Gardnerella, Streptococcus, these are reached in the mother's endometrium. We need to taste that, and if we can find the reason out, then there are treatments. That is the most important thing to tell. In the endometrial receptivity assay, where it is needed, then we will find the expression, we will investigate regarding the window of implantation, that when we should implant the transfer the embryo in the specific individual. Actually in 25% to 30% individual, the window of implantation shifts a little bit. It's not same for all. So in some cases, to investigate regarding the RIF, we need to determine the window of implantation through ERA testing, that is endometrium receptivity assay. And embryo aneuploidy, that is very important to find out regarding the current guideline. In the first recommendation where intervention is recommended, optimization of lifestyle factor, genetic counseling is also recommended. Genetic counseling is very much necessary for the psychological aspect, the socio-psychological aspect, as well as to find out the proper reason why the recurrent implantation failure is happening in the particular individual. Where relevant, after genetic counseling, we can suggest a PGT, that is pre-implantation genetic testing. We can test the embryo before transferring in the mother if a chromosomal abnormality is detected through karyotyping in the couple. So whether that is necessary or not, to determine that which line of investigation will work out for that particular couple, we need to do genetic counseling. So in intervention on RIF, it is highly recommended by SAR that genetic counseling should be done to determine the particular reason for that couple who are facing RIF. And most promising therapeutic options are also there. These days, peripheral blood mononuclear cells are being used, platelet-rich plasma, PRP therapies are being used, subcutaneous granulocyte colony stimulating factor, SGC, SF therapies are being used. So if we can find out the reason that whether the microbiota is responsible, whether window of implantation shifting is responsible, whether the embryo aneuploid is responsible, so we can determine accordingly that in which line we need to proceed. And the most promising thing is that throughout the world, around in 95% cases, it has been reported, if we transfer good quality embryo continuously 3 to 4 times, in 95% cases, successful pregnancy the patients they have achieved. So don't lose your hope. Just try to proceed in a proper way. When necessary, just go to a genetic counselor, together a genetic counselor, obstetrician, IVF specialist and embryologist. They can find out the proper way how to solve your problem. Thank you.